Ramadan Mubarak. We are in the holy month of Ramadan, which invites us into patience, trust, and mercy. Today, for this special episode, I am joined by psychologist Judy Seoud to unpack how Islamic concepts can gently support our mental health. Welcome, Judy.
Hi, it's nice to be here again.
It's nice to have you. This is a topic that's very close to both of our hearts. We spent quite a bit of time going back and forth about all of the different things that we could touch on today. What would you like to start with?
So I want to draw some parallels between different psychological concepts that already exist in Islam. And just to kind of give the crowd an outline, there are three major ones that we're going to, I think, cover today, which are Tawakkul, Sabr, and Muhasabah. And, you know, I see these conversations happening a lot in session with clients, especially with Ramadan being here. A lot of people use this time to like reset and ground themselves back in their connection to God. And Tawakkul comes out a lot. It comes out a lot at different times of the year, but specifically this time.
Yes.
And what Tawakkul means is basically trust. Like it's a trust fall personified. And it's accepting that things are not going to be in your control. And that there's going to be a point, after a certain point, you're just going to have to trust that things are going to work out. And that is a concept that really baffles a lot of people. Like, how do I just trust? And this is especially true with clients that lean more anxious and that tend to almost be hypervigilant and have that difficulty with letting go and trust. And just to explain the tawakkul piece, it almost means in the Arabic sense of the word, wakil is when you entrust someone with your affairs. So this could be in like, let's say if you have a court case, you entrust a lawyer with your case. Or if you have a medical procedure going on, you entrust a doctor to oversee your treatment. And there has to be a point where you hand the lawyer your documents, you give them all the information, and then you have to trust they know what they're doing. And again, for clients that are really anxious, it's like, absolutely not. I don't know how to do that. And I guess, have you ever heard of the tie the camel metaphor, not metaphor, but the story? So there's a story, an Islamic story about how, this man asks, like, should I leave my camel untied, go to sleep and just trust God, or should I tie my camel? And the guidance was, no, tie your camel and then trust God. And in that, or tawakkul, have that tawakkul. And so in that, there is a beautiful lesson of you also have to do your part.
Yes.
And you can't just leave it to like, I'm just going to let my camel wander around. I'm going to hope the next day I wake up and it's still there. Does that make sense?
It makes a lot of sense. And I think that what's coming up for me is that when it comes to psychological concepts, as we've spoken about before, people tend to really dichotomize and make things black and white when things are not really black and white. So what I'm hearing from you is that there is this concept, tawakkul, which is about trusting and surrendering, but that doesn't also mean being incredibly passive. You can still be active, you can still take steps, you can still take decisions, you can still do the things that you need to do, and not just blindly trust inactively, right? So it's not that extreme. But then what I'm also hearing is for people that struggle with anxiety, it's difficult because part of keeping our anxiety at bay is being overly controlling and being very vigilant of all of the things that can go wrong.
100%. And it's thinking about, so if we're staying with the tie the camel thing, it would be, yeah, but what if someone steals a camel? But what if the camel just wanders off? What if the camel dies? I need to be with the camel all the time.
Yes.
And it's this refusal to let go after you've done your part. Right? Like, you've done your part. You've tied the camel. You studied for the exam. Right? And after that, you kind of have to just let it play out the way it's going to play out. Versus there's also the other route, which is more passive, which is more, well, I have an exam. It's coming up. I'm not really going to study for it. I just trust that everything's going to work out.
Yeah. You know, as you were saying that, what comes to mind for me is like the worry tree, the CBT worry tree. If you're familiar with it, it's what we can use to help people differentiate between helpful versus unhelpful worries. Unhelpful worries are the hypotheticals. Like you said, what if the camel runs away? What if the camel dies? What if the camel is stolen by, I don't know who is going to show up and take my camel overnight? Those are the unhelpful things that you don't really have any control over. And so ruminating, worrying, hyperfixating on them is only going to be difficult and not really result in any actual change. Letting go is really the way to go, although it is much easier said than done. Whereas the helpful worries are, you know, these are things that are within my control. So I don't know, and I can't control exactly what the camel's fate is going to be, but there are things that I can do to kind of prevent things from happening, right? I can tie it. I can keep it in close proximity to wherever it is that I'm resting, and so on and so forth. And like you were saying with the exam, if we want to extrapolate to that, you know, what if I get asked a question that's just random that I could never, okay, well, there's not really anything you can do with that. You know, that's unhelpful. Whereas feeling worried that you're not going to perform and score well might motivate you to engage in a behavior that ultimately is going to change the trajectory for you.
100%.
Yeah. So how do we do it?
The letting go piece, again, it is a trust fall. Yeah. Right. But maybe you start off small, right? Maybe you don't start falling off a cliff, right? And trusting that, you know, having that tawakkul. Maybe it's like a little ledge. And choosing things, especially in the beginning, as you're starting your journey with tawakkul, is and having that trust, starting with tasks that feel a little bit more accessible, that feel a little bit more like, okay, I can do this and doesn't try to let go. I can, I don't know, what would a little task be or a little thing be, but okay, I trust that if I leave the house at a reasonable time, that I'm going to get there on time, and I'm not going to start over worrying about, oh my God, maybe I should leave even 10 minutes earlier or before. Just leave the time that you should. You know that is ample amount of time for you to get there, and you should get there on time. And in the meantime, as you're doing this tawakkul, you're practicing it, potentially doing other things that bring you comfort. So in Ramadan or Islam, it's like maybe even doing some like dua, like talking to God, or it could be as you're driving to your destination and you're worried about getting late, call your friend up or call your mom up and just like chit chat, get your mind off it. Don't let it be the thing that you just fixate on. And in that way, it's almost like distracting yourself to get there, making it tolerable, and not just like sitting in your distress and just being uncomfortable and just, it's all you can fixate on now.
So what I'm hearing from you is that this is an Islamic concept that can support mental health through facilitating distress tolerance. So we are going to face difficulties over the course of our lives. That's just part of the human experience. And when we have that trust, that faith, that belief, that can really help us let go of the things that are outside of our control and feel more peace.
Definitely. And I think this beautifully segues us to Sabr, which is having that sense of patience in the face of adversity, in the face of distress. And what Sabr is patience. But I think that within kind of more Islamic communities, it's often also taken as like, well, just be patient, you know, just, it's fine. It'll be fine. Just deal with it. And language is very important to me. So I love like fixating on sort of like what language we're using, what words we're using, and putting just in front of something just minimizes.
It does. It really does.
Right. And it's like, well, just be calm. Just relax. Right?
Yeah.
That hit a nerve.
It did.
Right?
If only.
Right? If it was that easy, well, I mean, sure. But the just be patient. It's reductionistic, and it's not what Sabr is meant for. It's having that patience. It's being able to tolerate distress and regulate your emotions so far as you're able to not act upon them, but making an active decision as opposed to just being taken by your emotions. Does that make sense?
It does. It does. But walk me through what that looks like in a therapy space.
Okay. So let's say a client is going through a really difficult time and they are going through all sorts of emotions. It can be sadness, anger, grief, anxiety, and it feels like there's no end in sight, right? Now, it would be really bad if we came into the room and just be patient, just relax, just trust the process. Sabr in therapy takes the form of increasing your window of tolerance, right? So let's say an emotion is really hard to carry. We in the room try to help you find a way to carry it in a way that isn't as crushing. Because there must be something going on where your nervous system is taking on more of a load than it should. And it's weighing you down. And so if it's, let's say, grief, for example, losing someone important to you, losing a friendship, different kinds of losses. But let's say it's losing someone's death. Okay, are there things that we could be doing to ease that load off of you? Grief is natural and it's part of the process, but could you be engaging in some sort of activities that make it a little bit more tolerable? Could we, if someone struggles with, let's say, irritability, right? And just immediately gets fired up. They've been dealing with so much for so long and they're just about to crack, and their fuse is really short.
Yeah.
Okay, instead of this immediate fuse, this impulsivity to just like act, could we help you take a step back for a second? Right? Could we help you take a few breaths before you actually send off that like text that's like extremely aggressive and upsetting and angry, to where the emotion's not in control, you are in control. That's how it shows up for me in session. I'm curious if you deal with it any differently when it comes to your...
No, what I'm hearing from you makes a lot of sense, and it's definitely something that I have experienced as well. But what I'm really also hearing is that there is quite an overlap between the two concepts that we've talked about. So if we're sticking with the example of grief or any sort of overpowering emotion, it's really important to emphasize, as we have done in previous conversations, that these emotions are normal, they're natural, they can sort of fluctuate, they're okay, and sometimes are really, really hard and really challenging in the aftermath of a loss. For grief, you might also just be in a depressive episode and just really experiencing profound sadness. These are normal feelings to have that just become very, very heavy, right? And so what I'm hearing between the two concepts is that there still is an active role that the person can take. So it's like, I trust and I surrender that maybe this is what is meant for me. I also can do things that I know are going to be helpful for me. If I'm experiencing sadness and loneliness and isolation, as difficult as it is to pick up the phone and try to reconnect with someone that I care about, I can gently, slowly work on getting there. I can send a text, a social media message. I can make a phone call. We can meet up. Gradually, pushing myself outside of my comfort zone to be able to tackle that emotion head on so that I can experience some sense of relief. So that active piece is definitely there, but also this idea of being patient. Things don't just disappear and go away overnight, and just trusting and surrendering to that process. So I just hear it all very
100%.
interlinked.
It is very interlinked, and it's also when you're practicing that active sort of being in the process and not just like passively just going through the motions. What I heard you also saying was you identified the emotion. It wasn't just kind of everything's fine, I'm fine, and like I just have sabr, everything's going to be okay. You identified, no, I am going through a really hard time. I am not having a good time right now. And I'm going to, let's say the example is, I'm not enjoying my job right now. And I can acknowledge that. And
You better not be talking about yourself.
I'm loving my job. This is great. I'm having a great time. But I'm not enjoying my job. This has been really draining, really difficult for me. And in the meantime, I can acknowledge that. And in the meantime, I'm going to be looking for other things that might give me more purpose, more sort of fulfillment. But you cannot bypass I'm fine, everything's fine. Why am I so weak? Why am I and sort of like going into this like self-deprecating mode? Because that often happens when someone's just like, just be patient. And when you can't find that patience, like, why am I weak? Why is everyone else doing great and I'm just struggling?
I think it's such an important distinction, because I think also what happens, you were saying that it's very reductionistic, this just. It's also something that comes from a place of really good intentions for most of our loved ones. So if they do find us experiencing whatever heaviness it is that's going on in our lives, one of the ways that they think that they're being helpful is to say, just move on, and to recognize that it's not so easy. In fact, it's actually quite atypical to be able to just move your way through. And even if you're able to do it in that moment, it's probably going to catch up with you a little bit later. And taking small steps and needing to take those small steps and being overwhelmed at times by those small steps, it's okay. It doesn't mean that you're flawed or that you're 100%. Impatient.
And we really I'm going to put Middle Eastern culture on blast a little bit. We thrive on this. Like we sort of, one of the things that was very much in my household was like, well, so many people are suffering, right? So many people have it worse. Yeah. Right. And it's, again, reductionistic, right? It makes you feel like, okay, then is what I'm feeling just invalid? Am I just being a crybaby? Yeah. But in that moment, you can also gentle parent your parents and just be like, people are suffering. And I'm also having a hard time. Two things can exist at the same time. We don't need to play oppression Olympics.
Exactly. And what comes up for me when you say that is sort of the opposite, but also very similar statement of, you're so lucky, you have it so much better than everyone else. It's like, you know what? I thank God for my blessings, and I know that I have many things for which I'm very grateful. Full stop. This is hard 100%. And I don't like this. And those two things can coexist. And I think, I said earlier that there's this whole lack of gray when people talk about mental health. Everything is very black and white and dichotomized. There also is this either or. Yes. Right? It's important for us to recognize that no, two things can coexist even if they seem like they're not very compatible.
And I think this segues us beautifully into muhasabah,
Mm-hmm.
which is all about having that balance. Literally, it's about being able to acknowledge what you're going through or any sort of mistake that you might have made, and also give yourself mercy.
Yeah.
But let's backtrack. And what is muhasabah?
Yes.
Muhasabah is a really deep self-reflection. It's looking at your own actions, your own behaviors, your thoughts, and seeing if they are in alignment with your values and your morals, if they're matching up. And if there's been any sort of dissonance there, it's having that quiet reflection and saying to yourself, hey, I didn't act in accordance with my own values. How am I going to do better next time? And in that, it's very different than kind of, it doesn't hold a sort of cruel or punishing tone. And that balance can be really, really tricky
Definitely
for clients to balance in session.
Well, and it's one of the most important things in therapy, right? One of the most critical skills that we need to have to be able to grow and develop as people is to be able to introspect, to self-reflect, to evaluate ourselves in a way that is reasonable and fair, and to be able to call ourselves out on things that maybe we're not proud of. And what I'm hearing from you is that it comes down to really thinking, this is who I am. This is my belief system. These are the values, the things that are really critically important to me. Am I behaving in a way that is in accordance or in opposition to? In accordance, great. In opposition to, okay. Rather than jumping immediately to, you're a terrible person, you're so wrong, you should never have done this, it's approaching it more with a sense of curiosity. Like, this isn't who you are.
Right.
What is kind of making this happen, enabling this to kind of continue? And what are some things that we can do to live in a way that is more in line with your personal, including your religious values and beliefs?
100%. But that's also, it's such a tricky balance to have. And so oftentimes in session, the way that it shows up is rumination, right? It's this sort of difficulty with that piece of, all right, and now we move on, and now we do act in accordance with our beliefs and our values and our morals. It's this getting stuck at, I'm a terrible person. I'm the worst. How could I have done this? Why did I do this? And just going down and down that rabbit hole. That is self-punishing. And whereas muhasabah is, relatively speaking, it should be a pretty quick and easy, painless kind of, maybe you take 5 or 10 minutes to reflect on, you know what? I'm disappointed in myself. Like, that wasn't cool. I didn't like that I did that. Okay. What can I do next time? Versus rumination, you just sit in it for hours and days and weeks and just like keep replaying things that have happened and not allowing yourself to move on. And muhasabah invites this gentle sort of expression of guilt, right? Where it's like, I did a bad thing, versus rumination invites you to shame, which is, I am a bad person.
Yes. A very, very critical distinction. And when you were talking about rumination, I was thinking about some people that I've encountered previously who will recognize, I shouldn't have done that. That's not in line with who I am and who I would like to be. Then course correct, but still be hyper fixated on, I did that thing that time, and that makes me a terrible person, irrespective of recognizing it and doing something different. So it's also really important, I think, to recognize that it's a normal human experience to, at times, do things that are not necessarily in line with your values. I'll give an example just to kind of clarify for our audience. Let's say one of your really key values is kindness, and you're having a really difficult day because despite giving yourself 10 extra minutes to get somewhere, there was a horrendous traffic jam and you're 30 minutes late. And also one of your other values is punctuality. And so you get to the valet, which is very common for us here in the UAE, and you just jump out of the car and like snap at the person, the keys in the car. That's not very kind, right? And it's important to take a moment to reflect. And in that reflection, later, you might say, okay, well, I think I was triggered because I was angry. I was tired and I snapped and I shouldn't have. And that was the wrong thing to do. Right. So it can be very small, mundane things. It doesn't have to be huge breaches. But then I also have to forgive myself for that and continue rather than berate myself for, do you remember that time when you snapped at that poor valet guy? Right.
And I love that example because that has happened a time or two to everyone here in Dubai, especially with the traffic jams. Like you're 100% going to get caught in unexpected traffic at some point. But yeah, it makes you irritable. It makes you just like snappy. And that sort of forgiveness that you offer yourself after you've done the muhasabah it's a journey. And just because you reflected once and you're like, oh, I snapped, I shouldn't have, and I'm going to try to do better next time, you still might snap. Yeah. Right? Chances are
you probably will.
Right? But that doesn't mean you just abandon muhasabah and you're like, well, that didn't work the first time. I'm not perfect yet, so you're never going to be perfect. That's not part of that's not an option on the table. But it's still striving towards doing better. Even when you're imperfect.
Yeah, definitely. And, we've talked a little bit over the course of this conversation about different behaviors. There are also rituals that we have in Islam that can be very grounding and supportive of all of the concepts that we've discussed, as well as broader mental health. As we said at the beginning of the episode, we are currently in the holy month of Ramadan. So maybe we can talk a little bit about that.
Yes. So obviously it is fasting. It is, a lot of people see it as depriving yourself of certain things. I choose to look at it as sort of increasing your mindfulness by removing distractions, which, I mean, food, like the second you remove food, you realize how big it is in your life and how it's just like, what am I going to eat? What time am I going to eat? When's my next meal? And socially, also things just revolve around food. And so when you take that away, it leaves room for more mindfulness. Tuning in even to your like bodily cues, like your hunger cues or your thirst cues. And it's a really, if you break it down, you're fasting from food, water, your sleep schedule is out of whack, right? And no intimacy during the fasting day. Those are the three major like categories that humans, like those are our basic needs, right? And so you're taking them all away. What's left? And there's this sense of increased mindfulness and increased sort of connection with yourself and to God as well. And it could be really grounding for people, especially because it is a community event.
Yes.
Right? The whole community is joining in. From the cooking, like you have like 3 different chefs, like your teta, your mom, everyone's in the kitchen, and teta means grandma. You're in the kitchen, and the prayers afterwards, right? If you're praying as a family or even breaking fast as a family, where you're usually just like everyone's having their meals at different times during the year. But this is a time where it's like we're all together. And so there are different sort of benefits that come from the fasting that happens in Ramadan. I wanted to highlight that, but then there's also the prayer piece, but I wanted to see if you had any thoughts about.
Yeah, no, I think that, the fasting, you really clearly outlined all of the different benefits. There's benefits on an individual level, there's benefits on a, community level, and there's also benefits within our smaller social circles. So I think you put it really beautifully. But, when you were saying a lot of our social connection revolves around eating, it's true. This past weekend, I was in the mall during the day, and I was like, wow, we're not stopping to eat. We're not stopping to drink. We're just walking, looking at things, talking to. It wasn't even for the sake of buying anything. I think we left empty-handed, but it was just moving our body and connecting with one another. Whereas outside of this holy month, we would have probably just sat and had a coffee and like doom scrolled on our phones next to each other. So I think there is this opportunity to slow down and really reflect and connect with ourselves, connect with God, and connect with people around us in the smaller as well as the broader community context. And I think it's important because, we're social beings as humans. And there's even quite a bit of scientific literature that shows that religiosity, being religious, is linked with better health, including mental health outcomes. And some of the explanatory factors for that include that people that are religious tend to be more hopeful, more optimistic, but really importantly, are part of faith-based communities where they don't have to be alone and they can come together over something that is so meaningful and transcendent.
And it's especially, the UAE is more of a collectivistic society, but even abroad where they're practicing, and it might be even individualistic societies, there is that sense of like, okay, we're actually just coming together now. And as you were talking, it also reminded me that we talked about the fasting that we do kind of on a bodily level, but there's also this increased mindfulness with fasting when it comes to fasting from anger, right? Fasting from backbiting, fasting from so many things that we just do unconsciously sometimes. And it really is just tuning into yourself and really, again, holding yourself accountable when you do mess up, and sometimes you might lose it, especially if you're fasting, your irritability is going up, but there's also that distress tolerance of, even if your irritability is going up, that doesn't mean you need to act on it, right? And like you have to actually try to not act on it. So in that way, not just being a slave to your emotions and just going with whatever feeling that you're experiencing.
Well, and as you were saying that, what comes up for me is that, this fasting process also shows you just like how strong you can be, that if you really want to do something and put your mind to it, you can.
Yeah.
And sometimes in our day-to-day functioning, we forget that. So it's a reset in some ways, I think, and a reminder of the strength and power that we do actually have in our own lives in the context of all of the other concepts that we spoke about today.
100%. And so Ramadan only comes once a year, right? And it is a time to reset and reflect and pause. But if you think outside of that, there's also the 5 prayers, which is an active time every 5 times a day where you're invited to have that pause and that reflection time, where you literally have to stop what you're doing and engage in this act. And it can be really regulating for people. It invites a lot of structure and discipline to your life. So does fasting, and those 2 acts, you're doing them even on the hard days. So you're talking about like resilience and how much we can actually, how much we can actually tolerate.
Yeah.
It's doing it even when it's hard. And I think doing it, especially when it's hard, is more meaningful. So it's almost like going to the gym, right? Like it's, you know, when you don't want to go to the gym, that's when it's so imperative that you get yourself to the gym. And same thing when it comes to whether it be fasting or prayer.
And I think when it comes to prayer, if we kind of zoom out and think about some of the things that we discuss in therapy when we're trying to help our clients identify things that they can do differently to address challenges, it's the small, and when I say small, I don't mean the weight or the value or the meaning is small. I mean the time commitment, right? It's only a matter of a few minutes, right? Every single time. And a lot of change can come from that. Before you start and after you finish can be quite transformative, even in a short period of time. And while maybe other things that we might do might not have that same effect and are not comparable, we can do small things throughout the day to help us navigate our difficulties.
100%. We often invite our clients to just breathe. Literally, I have clients just schedule breathing. I'm like, put it as an alarm on your phone. When you're at your lunch break or whenever, you need to pause and breathe because your nervous system's been dysregulated this whole morning because of your meetings and whatnot. You need a second to remind it, actually, I'm fine. Everything is fine.
Yeah, exactly. Speaking of this, I just kind of wanted to ask you a little bit about clients seeking therapy. So at Thrive and in this context, it's a very diverse community that we're a part of. And we're lucky that in our team, we have a huge diversity in terms of language and nationality and age and all sorts of things. Now, sometimes clients will specifically seek a therapist from that kind of is similar to them. Maybe a female wants to meet with a female or a male wants to meet with a male, or someone from a Middle Eastern country wants a Middle Eastern person so that they can speak Arabic. We're now also having people specifically requesting a Muslim therapist. Do you think that it is helpful for a Muslim client to be matched with a Muslim therapist? Or is it a case of, as it is often in psychology, that it kind of depends?
It kind of depends.
Okay, tell me more.
So it can be a really beautiful thing when a client sees parts of themselves in their therapist, where it's like, like, you're a woman, I'm a woman, you're Middle Eastern, I'm Middle Eastern, we're both Muslim. Like that could really create a really strong rapport. And it often removes the burden from the client to have to like educate their therapist on like, this is what this means. And this is what like this means. And so they can just dive into it. The flip side is that it's important to recognize, especially in this context, you're coming to a therapist that happens to be Muslim, right? You're not coming to an imam, right? And there can be this over-identification with the therapist where it's like you're looking at them to be like you're my gold standard on what it means to be like, I'm going to follow your lead. And that can be really tricky territory.
Yes.
But similarly, from the therapist side, there can also be counter-transference where the therapist also sees themselves in the client and over-identifies and then maybe wants to like rescue the client whenever they're in distress, or they avoid challenging their narratives because their narratives feel very similar to theirs. And the client goes like, you know how it is. And the therapist like, yeah, I know how it is. No, actually tell me how is it for you? And why do you just automatically believe that specific thing? Does that make sense?
It does. It definitely does. And so what I'm hearing from you, and I think it's an important thing to emphasize for our viewers, is that it really helps it's critical actually to feel comfortable and connected with your therapist. You might feel more comfortable or warm up more quickly with someone who is similar. But just because we are ticking the same boxes, whether it's our nationality, our age, our gender, being a mother or not being a mother, all being married or not being married, all of these different things, our experiences are going to be different. And we're not here to discuss the therapist's experience. However, the therapist has a frame of reference that makes it easier for them to get generally and more quickly what it is that you're experiencing.
But it's also not necessary. You know, sometimes you meet with a therapist that's completely different from you, and that therapist does their due diligence, and
due diligence is very key.
They educate themselves, and whatever gaps are still there, they ask you to fill. But then it's not as daunting as like, explain everything to me from A to Z.
Exactly.
And those are still also really beautiful and fruitful therapeutic relationships.
Yeah. So I think the conclusion is it's not required. It can be helpful in certain ways, but also an ethical and professional therapist should be able to bridge those gaps to a large extent. And the other thing is that our role, while we can draw on Islamic concepts because there are so many of them that do support mental health as we discussed today, our role is not to be imams. Our role is to help people connect with their faith, if that is something that is important to them and can be useful to what it is that they're experiencing. And if their faith is important to them, then for sure, the concepts we talked about, as well as many other elements of Islam, can be helpful in, you know, finding the way through whatever it is that they're experiencing.
And it doesn't always have to be the topic of discussion, like you were saying. Like, even if, like, if they are bringing it into the room as a topic for discussion and they want to make it a part of their therapies to talk about these concepts or how they apply to their lives, amazing, great. But if not, we're not going to bring that into the room.
No, exactly. Thank you, Judy, so much for your time today. It was a really interesting conversation about how Islamic concepts really can support mental health. And I appreciate your insights as always.
Thank you so much. I really enjoyed this episode, and they're two of my favorite topics, so I could just yap about them for an hour. It's great. Thank you.
Thank you.